Good morning, everyone. Dr. Michael Patmos here. It is May 31st, and I have a little follow up on Trump's medical problems. For those of you who have been paying attention, Trump had his third or fourth, quote, annual physical in the past year at Walter Reed last week. So, first of all, there's no such thing as your third annual physical. Annual physicals are done annually. He's having very close follow up for a reason. And he's misrepresenting the results of his examination. In any case, as you probably know, he had his third annual physical in the past year, last week at Walter Reed, and he proudly proclaimed that his results were perfect, that he's in perfect health, and that he had a very difficult, highly complicated intelligence test on which he scored a perfect 30 out of 30, indicating that he has extremely high intelligence. This is what he's claiming. The doctors also His doctor, who's a family physician, also released a statement saying that he's in good health, focusing primarily on his cardiovascular health, acknowledging that he has um, venous insufficiency and lower extremity edema, but it's under good control, and that his echocardiogram and EKG are normal, and in fact, using AI generated cardiac age, that he's actually got an EKG that shows that he's got the heart of someone 14 years younger. So he's 80, so that would be saying he has the heart of a 66-year-old is what his doctor's saying. But cardiovascular stuff is not the problem with Trump. It's not cardiovascular. Yeah, he's got some peripheral edema. So what? That's not a big deal. It's his neurocognitive situation that is of concern, and everybody knows it. And hundreds, thousands of psychiatrists have opined about this. People have been talking about his quote dementia for a long time. And so he had this exam, and he had his third or fourth MoCA test. The MoCA test is the Montreal Cognitive Assessment Test. It's a standard tool along with the mini mental status examination that we use in medicine. I am an internal medicine physician to screen people for cognitive impairment. And as people get older or they develop dementia, you'll see a decrease in the ability to perform on the MoCA test and on the mini mental status exam. These are not intelligence tests at all. Trump is either lying or just misinformed, and he's trying to misinform the public. These are not they don't measure intelligence. They measure your ability to do simple things, calculations, and recognize animals and tell time and stuff like that to detect whether or not there's a cognitive impairment. And you can do very well on a MoCA test or a mini mental status exam and still have frontotemporal behavioral variant frontotemporal degeneration. So what's going on here is, first of all, why is he having this MoCA test over and over and over again? He's having this test, obviously, because he's being monitored for this. He's being watched for evidence of cognitive impairment for a reason. Well, he's 80 years old, but even so, you don't do it 3 times in 1 year unless you're really wanting to screen for cognitive impairment. And so why are they screening so intently? Because his neurocognitive issues are so obvious. Uh, his manifestation, and by the way, behavioral variant frontotemporal degeneration, patients with that can score just fine on a MoCA test or a mini mental status exam for a long time. Not until they get very advanced in the degeneration, will their performance on those measures start to decline. Patients with frontotemporal degeneration, their deficits are not dementia in the classic sense. It's not like Alzheimer's disease. BVFTD presents with the primary manifestations are loss of inhibition. The first sign is typically when these patients start blurting out or saying things that are inappropriate and offensive, like calling reporters piggy, or talking publicly about women's menstruation, or saying things like grab them by the you know what. It's there's this statements that they make that are completely off the wall that no normal, sane person, healthy person would make in public. That's the hallmark manifestation of behavioral variant FTD. There is a well known example of a patient who had BVFTD who was brought to the doctor by his wife because he would do things like at the grocery store, at the checkout, in the checkout counter there, as a young gal was ringing up the groceries, he would proposition her in front of his wife. And it was like, what? Who does that? So it's the loss of inhibition and the stating, making ridiculous and bizarre and incredibly inappropriate comments, verbally and in other ways, is typical of behavioral variant FTD. Someone with behavioral variant FTD might very well do something like post a picture of Barack Obama as an ape. That kind of lack of a frontal lobe filter on appropriateness is the hallmark manifestation of behavioral variant FTD. There are others. Patients with BVFTD also lack and lose empathy. I'm not sure that Trump ever had much empathy, but they really don't care about anybody. They are very self-centered. They don't even other people suffering doesn't even register on them. Remember when a, a person fainted at the Oval Office right on TV a few months ago, and Trump just sat there and like, oh God, interfered with his video. And meanwhile, Dr. Oz and Dr. McCary, went to this person's aid, and Trump just sat there with a complete. That's lack of empathy. So he manifests the lack of empathy all the time as he talks about the fact that he gets a kick out of the fact that they talk about the loss of life in the Iran war, that 23 Americans have been killed. It's like, I get a kick out of seeing that. That's a lack of empathy. His comments about his incredibly insensitive comments about wounded veterans and veterans who've lost their lives, that kind of lack of empathy. There's also other um, manifestations as well. There are certain postural manifestations, postural instability, which he manifests. There's also sometimes word finding difficulties, which he manifests. And there's also a tendency to perseverate. These patients will repeat the same phrases over and over again. You hear Trump and all his speeches are the same speech over and over again. There's clearly a perseverative flavor to his communication. And then, in addition, there is hyperorality, manifested often by peculiar and excessive dietary preferences. Sometimes patients with BVFTD will demonstrate a decline in their table manners and will start to, gobble their food and eat unusual tendency to eat certain foods, like eating McDonald's all the time and in large volumes. And that's so. Anyhow, as you can see, there's very good reason to suspect Trump has behavioral variant FTD, manifests it completely, and the MoCA test is not a test to rule that out or rule that in. You can do very well on a MoCA test and have BVFTD. They're doing the MoCA test on him regularly, obviously, because they're monitoring. Because patients with BVFTD eventually will demonstrate a deterioration on the MoCA, but not early on or even in moderate disease. It really requires pretty advanced disease before that will show up as a decline in the MoCA score. He's doing this because he wants to convince you that he's just fine, and everybody knows he's not just fine, but he wants to convince you of that, and that's why he's doing this. So I thought I would clear the air about the MoCA test. It does not in any way, shape, or form measure intelligence. It is not a highly complicated, complex, difficult test. It's a very simple and straightforward test that anyone with a normal cognitive function should be able to score a 30 out of 30 on. and he's misinterpreting and misstating the what a MoCA test is, and he's doing this intentionally to mislead the public about his health. So I just want to be clear about that. He doesn't have dementia of the Alzheimer type, or the Lewy body type, or of typical of vascular dementia. He has typical frontotemporal degeneration, behavioral variant frontotemporal degeneration. The more you read about it, the more obvious it is that that's what he has. And he's being monitored carefully because at some point he's going to manifest a decline in cognitive function, but that is usually later on, and wouldn't expect he'll manifest that anytime soon. He'll continue to manifest his disinhibition and lack of empathy and impaired judgment, and that's really not something you want to have in someone who has their finger on the nuclear button. Imagine you've got somebody with their finger on a nuclear button who's disinhibited, has no empathy, and impaired judgment. That's the problem.